Hey everybody, my name is Kirsten. I am here today to talk to you a little bit about the neurocognitive disorder we've come to know as concussions. Concussions are a common injury in today's youth and have been a closely studied phenomenon both in the short term as well as examining the long-term effects. So the DSM-5 recognizes concussions as a mild form of traumatic brain injury. Additionally, youth patients presenting with a history of concussion may be at increased risk for suicidal behavior. In our text, Francis warns that overlooking any type of head injury can be a deadly mistake, and recovery should be prioritized and completed to the most thorough degree. Concussion diagnosis has increased it to approximately 3 million per year. I'll talk to you a little bit about how that number can be pretty significantly skewed, but it does currently account for up to 18% of all sports related injuries at the high school and collegiate sports level. Accuracy in diagnosis post injury can be impacted by varied symptoms experiences experienced by patients, including nausea, headache, dizziness, confusion, and other changes in cognitive functioning, including concentration, attention, memory. Field clinicians depend on athletes for self-reporting symptoms, which can lead to the potential of having this condition be grossly underrepresented. So, we're really in a position now where we're expecting concussed athletes to self-report their injury. And because of that reason, it can be grossly under documented. So the neurocognitive systems most susceptible uh, to effects of concussion include attention, concentration, cognitive processing speed and efficiency, learning, memory, working memory, and executive function and verbal fluency. The majority of research conducted on collegiate athletes suggests that cognitive impairments resolve within the first 7 days of incurring a concussion. So we'll talk a little bit later about the timeline and how that can be impacted by sex and age. The current neurocognitive testing measures for the assessment of sports-related concussion include the IMPACT test, the ANAM test, a concussion resolution index test, and a sports concussion assessment tool. So I'll talk a little bit about the final sport concussion assessment tool in a later article. But right currently, these are the most widely used methods of assessment, and all have a self-reporting component. So as I said before, a big part of diagnosing concussions really relies on the injured's report of their own personal baseline and also their own interpretation of symptoms, which, as you know, can be um, really just up to the individual. Most current screening methods require the injured to self-disclose their symptoms. As a result, concussions often go far underreported, as athletes have been found to minimize the seriousness of their injury. And this can happen for a lot of reasons. One, mainly if this pertains to a sports related concussion, there could be a fear of being withheld from competition, a fear of being demoted or kept out of, your position of play, and really the lack of awareness and familiarity of the signs and symptoms of a concussion. So, we have two kind of things going on here. The injured, sports related injured, could be underrepresenting their symptoms due to not wanting to be withheld from play, but they could also just be generally unaware of the fact that they may, in fact, be experiencing concussed behavior. The lack of reporting of the symptoms of concussion has proven to be a significant obstacle for managing concussions and also determining when it's safe for the athlete to return to play. So, again, because of the continuum that these sort of symptoms can exist upon this sort of plane for folks, it's really hard to determine when A, the athlete is back to baseline, and B, when it's more importantly, when it's really safe for them to return to regular activity, most specifically physical activity. There seems to be a general consensus that a history of concussion has been found to influence the risk of subsequent concussive injury. So, previous research really has indicated that an athlete who incurs a concussion is 3 to 6 times greater for sustaining a second concussion. So, once that initial concussion diagnosis is made, it really needs to kind of be like a long-term continued care plan in order to monitor for future symptoms, both in short-term recovery and also in the future, because these folks are so much more likely to become concussed again in subsequent injury. So, concussions are impacted by a couple different biologic factors. And the first one I want to talk about is age related recovery patterns. So, studies have shown that concussed high school athletes demonstrate larger recovery times with respect to neurocognitive performance than concussed collegiate athletes. So, we're finding that high school level athletes do experience and require longer recovery times than their collegiate level counterparts. Collegiate concussed players demonstrate memory impairments up to 24 hours, while high school concussed athletes demonstrate memory impairments up to 7 days post injury. So you can see, that is a tremendous amount of variance in the amount of impact to your memory system, just based upon age. Studies found that concussed high school athletes demonstrate memory and verbal impairments 4 to 7 days post injury, and more recent studies suggest that those same high school athletes may actually take up to 14 days to recover for a concussion. Concussed athletes exhibit impairments in the following systems 7 days post injury. That includes issues with reaction time, verbal memory, visual memory. Those same concussed athletes continue to demonstrate impairment on verbal memory for up to 14 days post injury as well. These studies suggest that high school athletes demonstrate slower neurocognitive recovery after a sports-related concussion compared to those collegiate athletes. So we really need to make sure that we're paying extra attention to the recovery time of our young athletes, because the requirements are just so much more for those younger folks. A couple reasons why. So I found a few studies that suggest that decreased myelination and a larger subarachnoid space in the cranium. So there's a couple physiological issues and really physiological development issues that could be creating those enhanced symptoms. Basically, that subarachnoid space in the cranium really allows for just more brain movement. So it could lead to additional trauma, less myelination of the nerves, as well as thinner cranium bones. All of those circumstances may predispose younger athletes to a more adverse effect of a concussion. In addition to that, the immature brain also has been shown to be up to 60 times more sensitive to some of the biological released chemicals that occur in the brain. Neurotransmitters that are released and things like that following a severe brain injury. So it appears that age really is a factor that needs to be considered when managing sports-related concussions, as younger athletes are much more at risk for severe consequences following a second concussion before the first one completely resolves. So what this is saying is we really need to make sure that our young athletes are fully recovered before returning to activity, because they have a much larger risk of re-injuring and re-concussing themselves before they've fully recovered from their initial diagnosed concussion. Some gender-related recovery patterns I found in my research as well. So female athletes demonstrated slower, simple, and complex reaction times following a concussion compared to baseline scores, and they're 1.7 times more impairments in the reaction time measures compared to male athletes. So there's a pretty significant noted difference between the experience of female athletes during their initial concussion symptoms versus men. Concussed female collegiate athletes perform significantly worse than concussed male collegiate athletes on visual memory scores. And some reasons for that, researchers have found that females have greater neurophil and decreased cortical neuronal densities compared to males, which may play a role in memory and information processing. In addition, females also have a much greater basal rate of glucose metabolism and cerebral flow compared to males, which may affect changes in the neurometabolic cascade that follows concussive injury. So lots of big words there, but the increased blood flow that females experience throughout their body, specifically in their brain, and the differentiating ways that physiological manifestation can impact the cascade of uh, events that happen after an injury can really increase those concussed behaviors. So, age and gender are really something that we need to take greatly into consideration when treating and really targeting a return to physical activity plan. For folks, it really needs to be kind of catered to their personal circumstance related to age and gender. Sports-related concussion is a puzzling injury for both the athlete and the sports medicine professional. I think I've helped you understand for lots of reasons that concussion impacts folks very differently. So it's really important that future efforts should focus on educating athletes, coaches, and parents on the signs and symptoms of concussions and the dangers associated with withholding these symptoms from sports medicine professionals. So it's really important that when experiencing concussion or possible concussive behavior, you're fully evaluated by a medical professional, and it's really a collaborative team effort around diagnosis and also the management of care during recovery. I've included a couple of videos that are definitely worth watching. The first one being how we can improve attention and cognitive problems following a concussion. So my first video, Dr. Nick talks a little bit about some strategies around recovery of concussion. We can improve attention and concentration problems post-concussion. This video states that concussions are one of the leading causes for attention problems in teens and young adults. This is because the trauma that is experienced by the frontal lobe. The frontal lobe is the area of the brain that helps us with cognition, attention, decision making, focus. Interactive metronome therapy is a leading therapy that Dr. Nick discusses in this video around incorporating a metronome into daily activities in order to keep kind of like a background rhythm when completing simple tasks. Can greatly influence the recovery process for individuals. So having an interactive metronome playing in the background and maybe clapping your hands while doing easy physical activities like marching in place or completing simple math problems or reading sentences out loud can really help to decrease recovery time for concussed individuals. Um, the next video that I cited is around, it's from a major Massachusetts news broadcast, and it really just talks about recent studies around reintegration of athletes post concussion. So historical studies and really just um, thinking had surrounded, this idea of when someone's concussed, they kind of sit in a dark room and wait until they're recovered. So in this video, they speak to more recent findings that reintegration really does reduce recovery time, getting kids back into the classroom, completing cognitive type tasks can really shorten the recovery period. The one thing that is stressed that this doesn't necessarily relate to physical activity. So it's really important that physical activity is withheld until cessation of symptoms. But getting kids, kind of out of the house, out of the dark room, reintegration into the classroom is they're really finding is helping to reduce symptoms and speed up recovery.
Hi everyone, welcome back. A new study suggests rest.
I've included a couple article summaries that I'll breeze through quickly, but definitely worth reading more in depth. The first article summary discusses quite a lot of concussed collegiate level individuals, a little under 400 of which were determined to require extensive amounts of times to recover from concussion symptoms. So all of these folks had sustained injuries through sport. And the study suggests recovery time by gender and really helped to determine a more typical recovery window during which individuals were able to return to sports. So studies suggest in that those that took longer than typical to recover from normal activity had a more successful long-term prognosis. This really helps to discredit past knowledge that those requiring longer recovery times were at an increased risk for lifelong chronic traumatic encephalopathy. So, recovery is generally achievable through additional time and injury management. So, we once thought that those that took longer than average to recover from concussion were really kind of inevitably predisposed to long-term cognitive effects. And this article really helped to discredit that belief that those who, for various reasons, do experience longer recovery time can still achieve sufficient recovery with adequate injury management. And my second article summary evaluates the usage of that sports concussion assessment tool. This is a three-part tool that it generally takes about 20 minutes to administer. And this article really kind of debates the ability with which this particular screening tool can feasibly be used within the setting of an emergency room. So just because of the nature of our emergency departments, a 20-minute long test really kind of holds up valuable resources because it takes so long to conduct this assessment. And because of the very high likelihood of being interrupted during the test, they found that in general, this screening tool is not generally a widely accepted tool to be used in emergency settings. They did find that components of the tool can more quickly assess concussive symptoms. And, the basic finding of this study is that this is a tool that is more appropriate to be used by field clinicians and really is not concise enough to be conducted in an emergency setting. I've also included some national resources for you guys to take a look at more up-to-date information regarding concussions. And that is it. So thank you guys so much for your time and listening to this um, presentation. And I really hope you learned a little something more about concussions. Thanks so much.